Yes, good afternoon everyone. My name is Joseph Njoroge Mungai. I am from Nairobi, Kenya. So I would like to share my story of how I ended up here in my life with pancreatitis. Now, in 2014, I was a bit younger, a very healthy man, young man. And one day after a short holiday, I started getting stomachache, a lot of it, a lot of pain in the stomach. And I started vomiting, diarrhea. And so after 2 days at home, I decided to go to hospital. So I went to Aga Khan Hospital in Nairobi, Kenya, where I was admitted. And for 2 weeks, I was in the, when I was admitted for the 2 weeks, half of that time I was in the intensive care unit. I almost died. But after a while, the doctors diagnosed me with acute pancreatitis, which they dealt with, and it went. And I was discharged from hospital, and life went on. So I continued with normal life until 2020. Again, after a small holiday. No, in fact, this time it was not really a holiday, it was a lifestyle I had, you know. I would go out with friends and eat normal food and eat poorly. And I started suffering again those kind of pains, only this time they were less intense. So I went on suffering like that for a number of years, from 2019, going on 2020, the pain every day, today pains, it doesn't stop. I'm admitted in hospital, given some treatment, come back home, after a few days the same pain. So I really struggled here, and unfortunately the doctors were treating me mostly for things like gastritis, because the tests I would do, endoscopies, would show that I had a small injury in the stomach. So that went on, and eventually, after a lot of struggling, I couldn't go to work anymore. My businesses started suffering. My wife said that we should see a specialist in Kenya.
Ellarigu Namaskara. I welcome all of you in my first press conference in Bangalore. I am from Uttarakhand, but very recently I have set up a clinical research unit in Malleshwaram area, where we are documenting our cases and publishing, and we also meet few inquiries, but majority of the treatment is done in Uttarakhand. So recently, just now, Mr. Joseph, and I would like to introduce Carol, his wife, who is here for last 2 months as an intern. She got so much interested in Ayurveda, so she spent a whole day with us. She understands Ayurvedic way of diagnosis and treatment. So this pancreatitis is a disease. I will not call it a disease, it is a death. Nearly 92% patients die within 10 years of the diagnosis. And one more fact about it, that this disease is a disease of modern world. First case came in 1652 in the world, in India 1937, but now India has the highest incidences of pancreatitis, and especially southern state of India, like Karnataka, Kerala, Tamil Nadu, Andhra Pradesh. And this is the top in the world. And the disease is of the young age, young people. But in 1972, my father, who was the Ras Vaidya, he formulated a medicine from copper, mercury and sulfur. It is Rashastra, which is toxic. And he converted that in 3 years into a medicine form. We call it Amar. And this medicine is doing wonder. We have treated nearly 1800 cases. And the last book we published, it has having 1111 cases. And this was released by Vice Chairman of Niti Aayog, Mr. Rajiv Kumar at Uttarakhand. So we are documenting our practice, we are publishing all over the world. We have also presented our work in Hawaii, USA in 2019 in a Japan Pancreas Society and American Pancreatic Association. And we feel that copper, which is described in Ayurveda, which is nowhere in modern medicine, has great anti-inflammatory properties to pancreatitis protective properties has been carried at Mysore, and it shows this medicine has pancreatitis properties. There is no cure for the bird, and gradually we are treating more and more patients, and we are developing it scientifically. So this gentleman was here for follow-up, and I think this is a great thing for our country, for Ayurveda. That's lifesaver Ayurveda. You might have heard about massage Ayurveda, health and wellness Ayurveda, but here we are practicing Ayurveda, which is a lifesaver. So Rash Shastra in Ayurveda is a lifesaver. This is the living example, and we have many cases from Karnataka, I'm here with you. Thank you very much for coming.